that actually, for those of you who are interested, we have almost half an hour left at the end of this symposium to discuss the talks. So I would suggest that we continue with the third talk on genetic aspects relevant in eating disorders, coming from obesity, given by Anke Hinney. And I guess you already have now seen that we are, how complicated to think of treat these patients, and that we are actually, when we increase body weights of patients with anorexia nervosa, we're dealing with a very complex organism with physiological adaptations to semi-starvation, and that weight reconstitution would then have an effect on these adaptive mechanisms and potentially even render a weight gain difficult, or weight maintenance difficult in these patients. And also you've seen how complex behaviors like restlessness might be linked to specific neuroendocrine abnormalities. Now, Anke is standing right next to me, and she will be giving a talk on the genetic findings. Thank you.
Thank you. Ladies and gentlemen, as you've been told, I'm going to give you a rough estimation about genetic mechanisms in eating disorders and obesity and the overlap between both. How to go forward? Okay. So there are pharmacogenetic studies that implicate or that show us that genetic factors are relevant for eating disorders and for body weight regulation. You've probably heard about twin studies analyzing monozygotic and dizygotic twins and looking between the differences and the similarities between those twin pairs, and being able to estimate the heritable part of a phenotype or of a phenotypic variance. And for body weight regulation, or for BMI, heritability is estimated between 50 and 60%. For eating disorders, both anorexia nervosa and bulimia nervosa, these heritability estimates are even higher, in the range of 70 to 80%. And so that we have good reasons to look for the genes implicated in these eating disorders. And you can go even further and look for specific traits within the eating disorders, and look for genetic influences on those traits. For instance, if you look in a female twin population, you can look at these monozygotic and dizygotic twins and look for dieting factors and bulimic symptoms, and these all the heritabilities are shown here, and you see that heritabilities are quite high for some of these symptoms. So we know that there are genetic factors affecting different parts of these disorders, and next step is to look which are the genes implicated in the etiology of eating disorders, and how are they overlapping with genes relevant in body weight regulation. And the first step is to have a look at candidate genes that might be implicated in these disorders. And you look in for instance, animal models or in pharmacological findings that had been shown previously, and so on. And so you end up with a huge list of potential candidate genes, and this is just giving you a rough overview about genes that have been analyzed for anorexia and bulimia nervosa. And you see in green indicated these are initial positive findings showing that a variation in these genes is relevant for the eating disorder analyzed. Most of these genes had not been replicated, or the findings had not been replicated in subsequent studies. So at the moment we do not have too many really solid findings, genetic findings for eating disorders, maybe except to a receptor. And so one might ask the question, if obesity genes are relevant for eating disorders as well. And you heard a lot about BMI and neuropeptides relevant for body weight regulation and for eating disorders in the previous talks. And I'm going to show you some data pertaining to genetics of obesity at first, and then the overlap with eating disorders. And well, you can see here that during evolution, there are genes that had been fixed in evolution that make you survive bad conditions, if you want. So in former times it was very hard to get the calories, and you had to have genes to harbor the genes and to be hungry constantly, sort of. And nowadays, well, the situations like this, the genes are not well adapted any longer. And to give you a summary of the genetic findings in obesity, there are certain individuals that are predisposed to obesity, and again, as I told you, heritability estimates range from 50 to 70%, and cause gene-environment interactions. And as you can imagine, the genetics of obesity is complex, so there are hundreds, maybe hundreds of genes involved, and each single gene, most of the single genes have just small effects on the phenotype. And you've seen this slide before. This is giving you an estimate on the different factors, hormones implicated or involved in body weight regulation, like ghrelin, as you've heard before, and insulin, leptin, and those signals signal to the brain sort of the size of the fat stores, and whether you should better take in energy, or whether you need to expend your energy to maintain a normal body weight. Okay, and well, there are some monogenic forms of obesity, so there are some genes that are more relevant than others, and they have a huge effect on the body weight. And you heard a lot about leptin before, and we know that that in the animal model, if you do not produce any leptin, then you get extreme. There are monogenic forms of obesity where a single variant in a single gene an extreme phenotype. And as you can see here, some of those monogenic forms of obesity have also a different eating behavior. So if you are deficient in leptin, then you have extreme hyperphagia. The same applies for the leptin receptor, and there are other genes, and you tend to overeat if you have a mutation in these genes as well. So there seems to be a combination between obesity and eating behavior. And you heard about leptin before, and there is a receptor in the brain sort of using the leptin signal and transporting it to different effectors, and leading to behavioral changes maybe. And this is a gene that is implicated in obesity, so there are relevant mutations leading to a loss of function of this receptor, and individuals who just have one normally effective copy of this receptor, that there is a claim that this is a major gene for obesity. This is how this receptor looks like. I just wanted to show you that there are many mutations. These are all mutations, all these variant positions, and all the single mutations are more frequently found in obese individuals than in controls. So this is really an obesity gene, to summarize these data. And what we did, we analyzed this gene in approximately 1,000 extremely obese children and adolescents, and we found 20 families, 20 individuals having these relevant mutations, and their obesity was sort of related to mutations in this gene. And you can see this family starting off with these two index patients, and this girl at the age of 4 years is already obese, as you can see, and at the age of 15 years she is extremely obese with a BMI of 66. And you can see that this two mutations in this receptor gene, one from the father and the other one from the mother, so she does not harbor a single normal copy of this receptor, and you can see that the BMI is more extreme than of her twin brother, who is just a mutation in one of these genes, one of these copies. And so we had a number of these families, 21 families, and we tried to figure out if mutation carriers are sort of different from other individuals within the families, and if the obesity can be explained by phenotypic abnormalities in these mutation carriers. And to summarize it, we mainly found that the mutation carriers are heavier than the non-mutation carriers within the families, and we could estimate the effect of the mutations, which was in females the effect is a little stronger than in males. So within these families, if you harbored one of these mutations, you were 30 kilograms heavier if you're a female, and if you're a male, then you're 15 to 20 kilograms than if you do not have this mutation. So this is quite a strong effect, a major gene effect. And well, we wanted to know whether this is also a gene for eating disorder. And why did we wanted to have this? You've seen this slide before. These are the DSM-4 research criteria for bulimia nervosa, and as you've heard before, body weight or obesity seems to be relevant in bulimia nervosa premorbidly. And we had a look at these mutation carriers, and we interviewed them and tried, as I told you, to figure out the phenotypic abnormalities in the mutation carriers, and we found nothing really special except that one of the female mutation carriers reported to have an intermittent binge eating disorder. So we thought maybe this or binge eating disorder. And you've seen this slide before. Again, these percentiles, and you can see that those patients had an increased BMI, and we found that this individual has a relevant mutation in the MC4 receptor. So seemingly, the MC4 receptor is relevant for obesity. We knew that before, but it might be implicated in bulimia nervosa as well. And maybe, well, the bulimia nervosa is sort of a coping mechanism to defend the extreme BMI. We don't know yet. Anyhow, this is just 81 patients. We, in the meantime, we screened roughly 350 also patients, and we found no, at least a very rare event to have a mutation in this gene for patients with bulimia nervosa. And there were reports that this gene might be implicated in binge eating disorder as well. And this is the first study published in 2003, and it pertained to roughly 500 extremely obese individuals, and there were several polymorphisms and mutations in this gene that were analyzed, and the conclusion of this study was that mutations in the gene were more frequently found in patients with binge eating disorder. And subsequently we tried to figure out whether we can confirm these data, and we performed in cooperation 2 studies. One also pertained to roughly 450 extremely obese individuals, and again patients with binge eating disorder were analyzed, and we found no mutations in the patients with binge eating disorder, so we found no confirmation of this initial finding. And again, we used the family study, as I showed you before, these large pedigrees, where we had mutation carriers and lots of family members, some of the mutation carriers. So we had a number of 74 carriers of relevant mutations in this gene, and we looked for binge eating behavior patterns in those individuals, and we couldn't find correlation between mutation carrier status and binge eating disorder. So we have no confirmation whatsoever on the, pertaining to this previous findings. So we think it's rather dubious that this gene is really relevant for binge eating disorder. And last but not least, I'm going to show you some data pertaining to genome-wide scans. So you can either use a candidate gene approach, where you sort of have to have an idea about the pathomechanisms involved in the disease or in the phenotype you're looking at. If you're with no hypothesis, sort of, then you can perform a genome-wide scan. So you look in the whole genome and try to figure out the regions in the genome which harbor genes that are implicated in the phenotype, and you have no a priori hypothesis pertaining to the genes involved there. And well, and there, as I said, the candidate gene approach has not been too sufficient for eating disorders, more sufficient for BMI, and maybe this is because there are wrong assumptions, and maybe there's an overestimation of effect sizes, and there are small study groups. But this is a summary of the genome scans for BMI that have been performed, well, until 202. There are some more in the meantime, and what you can see here, these are all the different chromosomes, and there are certain regions on different chromosomes where more than one study showed that there is a chromosomal region that is highly likely to contain a gene that is relevant for the phenotype, in this case BMI. And there are also 2 studies pertaining to genome scans, anorexia nervosa and bulimia nervosa. And I'm just going to show you the study pertaining to bulimia nervosa because there is an interesting finding pertaining to obesity. So this is a genome scan for bulimia nervosa. It pertains to 308 families ascertained by a patient with bulimia nervosa. And this is just a different kind of showing you the data. This is what we call a peak region. So this is a chromosomal region that is likely to harbor a gene that is implicated in bulimia nervosa. And this is on chromosome 10, and there's another one on chromosome 14. And when you compare these data, and you can have a more thorough analysis of this peak region, like you can have a look at the subgroup of families with at least 2 relatives with self-induced vomiting, or you can analyze the complete data set and you see there is hardly any difference between those subgroups. And what is more interesting, at least from our point of view, is that this genome scan region for bulimia nervosa had also been pointed out in genome scans for BMI, for obesity. And so this was a genome scan published already in 98, and there was a strong peak for BMI in chromosome 10, and this is more or less exactly the same region as for bulimia nervosa, so there really might be an overlap between those. And we screened this region as well, and we found, well, this is not significant finding, but nonetheless this is a peak in the same region, so there might really be a BMI peak or obesity gene that is also relevant for bulimia nervosa. And this is sort of where this story ends at the moment, because the gene underlying this peak for bulimia nervosa or for BMI is not known yet. There are a few reports pertaining to some genes underlying this peak, but they haven't been confirmed in subsequent studies, so we doubt whether the real candidate gene had been discovered yet, and so we are looking forward to see additional data in the near future. And just to give you a short glimpse about the future perspective in this sort of area, we are previously the genome scans relied on roughly 500 markers that were evenly spaced throughout the genome. Nowadays we can work chip-based, so on this kind of chip there are 500,000 SNPs, 500,000 genetic information per individual. And currently these chips pertain to 1 million SNP informations. And so you have a huge amount of data for each individual. And what you can do now, you can compare those frequencies of every single SNP between cases and controls. And this is something that couldn't have been performed a few years ago. And this is sort of the situation at the moment. If you check publications, you can see that within the last 5 or 6 months, a great amount of different studies for different complex phenotypes have been published. So in all these different phenotypes, with one study pertaining to 500,000 SNPs or so, novel genes had been discovered. And this is something that hadn't been possible years before. And for BMI, there are a few studies as well. The first was related to so-called Framingham families, and this is a family-based approach, and there was one SNP or one new candidate gene that had been discovered by this approach, and this candidate gene, this specific variant in this candidate gene conferred a slightly increased risk to become obese. So if you harbor a specific genotype, then you are 3 kilos heavier. than if you do not have this mutation. And this is what I told you in the very beginning. We think that hundreds of genes are involved in body weight regulation and presumably in eating disorders as well. And so each single gene cannot have an effect of 20 to 30 kilograms, but usually we think about effect of kilograms. Polygenic effect, one gene having sort of a small effect, but you find this variant in 10% of the normal population and maybe in 12% of the obese population. And we know some more of these polygenes. The most relevant one had recently been discovered. It's called FTO, like fat mass and obesity associated. It had been discovered by this 500K, so 500,000 SNP scan for type 2 diabetes. And when this scan was analyzed more thoroughly and it was corrected for BMI, then it turned out that really this type 2 diabetes gene was in fact an obesity gene. And again, the mean BMI difference for carriers of a specific allele is 0.4 kilograms per square, or 0.4 BMI units. But it's a second polygene, and this had been supported by many additional. So this gives you an overview about the polygenic obesity. So these are all different genes having a polygenic effect on obesity, and you probably noticed this is the MC4 receptor again. The mutations leading to a loss of function of this receptor lead to obesity, but there is a variant leads to a small decreased BMI, loss of 1.5 kilograms. So this was the first polygen, and these were both detected by these high throughput approaches with 500,000 SNPs. And well, we are not quite sure whether this really is a polygene for obesity, because there are non-conformations as well. But for the fat mass and obesity associated gene, we are very sure that this is really a gene for obesity, and it makes you 1.5 kilograms heavier if you harbor one of these variant alleles. And well, the near future will show whether these genes are also implicated in eating disorders, but the sample sizes in patients with eating disorders are usually very small, so it might be difficult to pinpoint these tiny effects. If you have a look here, these are the numbers of patients that were analyzed for the different studies, and you see sometimes you need around 7 to 8,000 individuals to pinpoint these small effects. So to give you a summary of all the data I showed you, there are seemingly overlaps between the genetic factors involved in obesity, this nervosa, and body weight regulatory genes yet, but there might be something in the near future. These high throughput approaches will be applied to anorexia nervosa and bulimia nervosa as well. So I guess in the near future we will have some more of these data for eating disorders as well. And you see there are tiny effects, and you need huge sample sizes to tackle these tiny effects. Thanks very much.